I found it was a way to really have a big impact on people's lives, to do procedures for them that don't really put them out or incapacitate them, and afterwards find that they are very grateful, their lives are improved, and they're just very happy they had these procedures done. Even though most people have been thinking about it for years, most are very, very happy when they finally get it done. Well, CVR has a very deserved reputation of being a very big and very excellent vein care provider. And I thought to get the most visibility for my practice and to potentially reach the most patients, aligning myself with a big organization like Center for Vein Restoration was a good idea. I treat all the patients like I'm a doctor, like their doctor visits, and I want everyone to feel like they're being cared for by a doctor who is very aware of their feelings and their condition and is able to bring the best skills and the best compassion to their situation. Well, quite a few. In another life, before I started this, I was a heart surgeon or a cardiothoracic surgeon. And so one develops a very acute and finely tuned skill set doing that. And I am able to bring all of the skills that I acquired in that specialty to this specialty and to become very proficient at this specialty, taking care of people's veins. Well, my role is patients will come to see me because they are concerned about problems with veins in their legs, and people have a large range of different problems. My role is to sort out the severity of their problems, to prioritize what needs to be treated and what doesn't need to be treated, and to provide them with really excellent outcomes, which is really very important. Especially when you're dealing with something that is usually not life-threatening, but is very life-affecting. Well, I'm a member of a number of professional societies, the Society of Thoracic Surgeons, the American College of Surgeons, American Vein and Lymphatic Society, plus a number of publications over the year, probably about 20 publications on complex topics of heart care over that time. I've also been recognized in the past when I was doing heart surgery as being a prime provider in both Washington Checkbook and Washingtonian Magazine. I'd like patients to know that no matter what their complaints, I approach them as a caring, compassionate, and knowledgeable physician, and that I will always do my best to make sure that they get the outcome they want, and that I'm very, very detail-oriented and quite persistent in ensuring that my patients get the outcome that they're looking for. Referring physicians should know that I will reliably provide them feedback on the patients they sent me so that they will know how everyone is doing, and that if they're not aware of my practice already, they will become aware of the quality of care I provide and how it differentiates from other vein providers.